Hi, my name is Christy, also known as Sullen Girl, and I'm the author of the blog Speaking Out About Self-Injury on HealthyPlace.com. Today I want to talk to parents and family members of someone that you suspect might be self-injuring. And I'm sure that a lot of people come onto HealthyPlace.com and go to the self-injury section because they're scared that someone that they know might be self-injuring. And one of the first things you think about is, what are the signs and what are the clues that you can watch for that might indicate that someone is engaging in self-injurious behavior. And some of the signs are fairly self-explanatory, and you might be here because of that. And, one of the biggest signs would be unexplained cuts or bruises. And I have been a self-injurer for over 13 years, and I'm currently in recovery. But when I was younger and I started self-injuring, I have a lot of experience in trying to hide my behaviors from parents and family, friends, and teachers. And one of the things is that if I had a cut or a bruise or something that I inflicted onto myself, I would always make up a somewhat bogus excuse as to how it happened. And if it was a repetitive injury and I kept being asked about it, I would always make up a story. And looking back now, I can see how the stories wouldn't actually add up and make sense. But at the time, I was telling these lies to try to, hide what I was doing. And so if you see an unexpected, bruise or cut or, injuries of some sort, burns, and there's not really a good explanation, that is your first red flag. So if they keep coming up, you might want to keep an eye on that. Something that is actually harder to detect is kids who have low self-esteem or are always down on themselves or feel really depressed. Those people are at a higher risk to self-injure because they might not be able to regulate their emotions in a healthy way. Another thing is if you find out that the person close to you has a hard time expressing themselves, they may turn to unhealthy coping mechanisms in order to get that release and to cope with their emotions instead of expressing them in a healthy way. Another quite obvious thing is if limbs like legs and arms are always covered by long sleeves or outerwear even in warmer weather. And a lot of self-injurers, that's probably the number one thing is long sleeves, long pants. And another thing that's really popular, I guess you could say, for self-injurers to do is to wear a lot of jewelry on their arms, bracelets, arm warmers, bangles. And so if you see that repetitively and you're feeling like some of these other things are adding up, you might want to keep an eye on the person that you think is self-injuring because it's quite possible that they may be engaging in self-injurious behavior. The last thing on my list, there are lots more, but the last thing on my list is the presence of a known eating disorder, substance abuse, or depression. And the reason for this is that self-injury is just a side effect of an underlying issue, and whether that's a personality disorder or depression or some other kind of thing, usually self-injury is just a side effect of that. And also people who tend to have eating disorders or substance abuse issues, those are also forms of unhealthy coping mechanisms, and so is self-injury, just like that. So if any of these things sort of jump out at you, and especially a combination of a lot of those things, you might want to keep an eye on the person that you care about. And then, of course, there are lots of other resources and videos, even in this blog, to talk about how to reach out to someone who you think might be self-injuring. Thank you for watching. See you next week.